With the rise of COVID cases in China, India is on the lookout for new variant, possibly of the coronavirus. With the surge specifically in China and other nations as well, the centre has decided to resume COVID-19 related measures at airports for international travellers. According to sources, there are currently 10 different variants of coronavirus in the country, and the latest variant is BF.7. Several states and union territories have advised sending samples of all COVID-19 positive cases to INSAC OG labs to facilitate tracking of these new variants. Now, there is a scare, of course. Let's not be alarmed, though. Let's be vigilant. Delhi Chief Minister will be holding a key meeting to review the situation today. Health Department has also been directed to ramp up genome sequencing in Delhi. That's again for new variant. Uttar Pradesh government, meanwhile, has issued an alert in the state. Officials have been directed to ensure COVID protocols are followed, specifically at, for example, the night shelters. Maharashtra government has decided to form a task force, study the evolving situation. Along with introducing new norms, Karnataka government has also decided to start screening international passengers at the airport.
केंद्र शासन के स्वास्थ्य विभाग ने कुछ एडवाइजरीज हर राज्यों के लिए की है। उस एडवाइजरी के तहत राज्यों ने भी काम करना जरूरी है। तो स्वास्थ्य विभाग ने, मुझे लगता है कि उस एडवाइजरी में जो लिखा है कि आइसोलेशन, अभी जो अगर कोई पॉजिटिव केस आता है तो आइसोलेट करना चाहिए और उनके सैंपल्स लेके जीनोमिक सीक्वेंसिंग भी करना चाहिए कि ये अलग कोई वेरिएंट है क्या, यह वेरिएंट है तो फिर इस वेरिएंट को किस तरह से डील करना चाहिए, उसकी ट्रीटमेंट किस तरह से होनी चाहिए, या ये जो हमने वैक्सीनेशन किया है यह वैक्सीनेशन उसको एस्केप हो रहा है क्या।
Remember, it's been almost 3 years now that the novel coronavirus, not novel anymore, but is still alive, kicking and causing mayhem. China is the country where the virus had originated from, witnessing its worst crisis again in 3 years. But this time, India does not want to take any chances. Our Health Bureau at India Today's team brings you and tries to analyze the current status. Take a look.
The fear of a possible return of the coronavirus has now got India on a high alert mode. Health Minister Mansukh Mandaviya held a high-level meeting to assess the India situation vis-à-vis China and said that COVID is not over yet. The worry? The infectious BF.7 that has been in circulation in China and has surfaced in India as well.
BF.7, the variant that is causing shock waves in China, already exists in India. In fact, it was spotted as early as in the month of September this year, and 3 times in total. But what the government is focusing now is on bringing back the mask mandates in the country. States will be asked to do so, and also looking at an uptick on the precautionary dose.
India is not looking at imposition of restrictions, but has asked for going back to the basics.
आप जब क्राउडेड प्लेस में हैं, अंदर या बाहर, तो आप मास्क करिए और जो व्यक्ति उम्र में बड़े हैं या कोमॉर्बिडिटीज हैं, उनको तो ये ज्यादा इसका इस्तेमाल करना चाहिए।
Experts say that surfacing of new variants and infectious sublineages need closer monitoring and sequencing. India has been lax on this front. The Health Ministry has also written to states asking them to ramp up sequencing.
Genome sequencing, on the other hand, is to send these samples to a specialized research laboratory that will look at the genetic makeup of this virus. Thus, they will be able to tell if new mutations have come or if the existing variants have changed.
The Government of India is also now stressing on the need to improve the uptake of boosters, saying that the uptake of boosters is just about 28%, which actually is fairly dismal. Very recently, the Serum Institute of India also spoke about the fact that it had to discard many COVID-19 vaccine doses because there is just no demand.
Particularly जो हमारे citizens, senior citizens हैं, वो कोई छूट गए हैं precaution dose से, तो हमेशा की तरह जैसे हम पहले भी अपील करते थे कि उनका हमें ज्यादा ख्याल करना है। सीनियर सिटीजन्स क्योंकि वल्नरेबल हैं और बीमारी वाले व्यक्ति वल्नरेबल ज्यादा होते हैं।
What the actual virus currently circulating is, whether it is a previously confined ancestral virus or a Delta variant, or is it from the Omicron family of variants which are currently the dominant viruses in the world for COVID. Based on that, we'll have to judge what the likely dangers are to both to China and to the rest of the world.
While China's situation is different from India and the rest of the world, the China crisis shows us that this virus that has the potential to cripple the world is alive and kicking even 3 years after it first raised its ugly head. With Milan Sharma in New Delhi, Sneha Mordani for India Today.
So I understand there must be alarm bells, there must be a worry again that we thought was over. But this variant driving China's surge has been found in India. While 3 cases have been detected in Gujarat, 1 case has been traced to Odisha. As is evident from the COVID chaos in China presently, this new variant has the highest transmission ability. As per reports, BF.7 Omicron variant is quicker to transmit, short incubation period, and has a potential to infect even vaccinated people easily. Symptoms remain the same. Just to give you a background: fever, cough, sore throat, runny nose. Experts say people who are not vaccinated or have weak immunity, such as elderly citizens, children, pregnant women, or ones with multiple comorbidities, are at high risk of catching this infection, so need to be more careful than others.